Good afternoon, dear students. My name is Janah Mohamedjanova. I'm an English teacher of the Department of General Educational Disciplines. Today's topic is tuberculosis. During today's lesson, we will work on enlargement of vocabulary on the theme, on improvement your reading and speaking skills, and also we will revise several grammar themes. Are you ready? Let's get started. As usual, we will start with our active vocabulary. Students, I will read only in English. Please listen carefully and after finishing, write it down to your copybooks and learn by heart. Attack, include, cause, cough, sneeze, germ, latent, night sweats, chill, fever. Once more, attack, include, cause, cough, sneeze, germ, latent, night sweats, chill, fever. Feeling tired, to find out, sample, sputum, urine, tissue, treatment, curable, prescribe, resistant. Once more, feeling tired, to find out, sample, sputum, urine, tissue, treatment, curable, prescribe, resistant. Students, we have finished with our vocabulary. Don't forget to write it down to your copybooks and learn by heart. Now let's turn to grammar. Today's grammar participles. You know that there are two participles in the English language: present participle and past participle. We form present participle by adding ing to the verb and past participle by adding ed to the verb. We know that the participle is not the main verb in the sentence. It functions as adjective. Here we have three sentences. Your task is to translate them into your own language, paying attention to the participles. The next task is present simple tense. We use present simple tense when we talk about our habits, our everyday life, when we talk about facts, and when we describe what we usually do. How do you form present simple? Affirmative sentences, subject plus verb. In the third person singular, we add s to the verb. Negative sentences, subject, auxiliary verb do, does, plus not, short forms, don't and doesn't, plus verb. Questions, auxiliary verb do, does, subject plus verb. Also, you have three sentences, and again, your task is to translate them using present simple tense. And now let's turn to our text. Before reading the text, we have a pre-reading task. What do you know about TB? In general, what comes to your mind, students, when you hear the word tuberculosis? First, yes, it's high temperature. Yes, we know that a patient with tuberculosis suffers from high temperature. The second, cough. The first symptom, the main symptom of tuberculosis is cough. Yes, you know it. The next, we know that tuberculosis is an infection disease. And the last, yes, it's X-ray, and because we can reveal, yes, the tuberculosis can be revealed by X-ray examination. Now let's turn to our text. Tuberculosis. Tuberculosis is a bacterial disease that usually attacks the lungs. It can also attack other parts of the body, including the kidneys, spine, and brain. A type of bacteria called Mycobacterium tuberculosis causes it. TB germs are put into the air when a person with TB disease coughs, sneezes, or speaks. These germs can stay in the air for several hours. Not everyone infected with TB bacteria becomes sick. There are two types of TB conditions. Latent TB infection, when a person has TB germs in his body but not sick. TB disease, active TB, when a person gets sick from the TB germs. Signs and symptoms of TB include a cough that lasts more than 3 weeks, chest pain, night sweats, chills, fever, feeling tired, loss of appetite, loss of body weight. To find out if a person has TB germs in his body, he may be given either a TB skin or blood test. Tests for TB disease usually include samples of sputum and chest X-ray. Tests for TB disease in other parts of your body may include tests of urine and tissue samples. With proper treatment, TB is almost always curable. Doctors prescribe antibiotic to kill the bacteria that cause it. A patient takes them for 6 or 9 months. Sometimes antibiotics used to treat the disease don't work. Doctors call this drug-resistant TB. Okay, students, we have finished with our text, and in order to check your understanding, please answer the following questions. What is TB? What bacteria does cause it? What types of TB are there? What are the symptoms of TB? How TB can be diagnosed, and is it curable? Your home task is to retell the text according to the given plan. First is, what is tuberculosis? You should give the definition. The second is types of tuberculosis. From the text, you know that there are two types, latent and TB disease. It means active TB. Then you should speak about symptoms, and the last is diagnosis and treatment. It means how TB disease can be diagnosed and treated. Dear students, our lesson is over. Thanks for your attention.